folic acid and is given 1/4 tablet of 25 milligrams of 5 milligrams. So it's 1/4 tablet of 5 milligrams every 2 days per week. Is equal to 2 days per week. 1/4 tablet of 5 milligrams 2 days per week. That is how we give folic acid. We have erythropoietin. Can also be used in order to prevent anemia, which is given as 250 international unit per kilogram. Is it clear? So that is how we give erythropoietin. The next one after that, we are going to have we have to prevent infection. To prevent infection, you just use ampicillin. You use ampicillin and gentamicin, no cefotaxime, in order to prevent infection. And ampicillin is given as a septic dose of 100 mg per kilogram and 100 mg per kilogram per day in 2 divided doses, while gentamicin is given at 3 mg per kilogram per day in 1 dose. Is it clear? That is the septic dose. Is it clear? In order to prevent. Now, if there's an infection, now add cefotaxime at the same dosage of ampicillin. Now, after infection, after infections, you have to also prevent hemorrhagic disease of the newborn. We prevent hemorrhagic disease of the newborn by giving vitamin K. Is it clear? You prevent hemorrhagic disease of the newborn by giving vitamin K. And you give vitamin K how? You give vitamin K at 20 mg per kilogram loading dose on the first day, and then the maintenance dose after every 24 hours, you give it at 5 mg per kilogram. It's in order to prevent the hemorrhagic disease of the newborn. Is it clear? And if they see anemia, you can give blood transfusion to the child or that. And blood transfusion, you need to know that there is a formula in order to transfuse blood. Generally, in neonates who are term, the formula for transfusion of blood is 15 to 20 mils per kilogram. And 15 mils is when you have packed red blood cells, and 20 mils is when you have 15 mils when you have packed red blood cells, and 20 mils when you have whole blood. Is it clear? Whole blood. So that either you can transfuse like that, or blood transfusion, you can also give it at 20 to 25 mils, but per kilogram instead in premature, where 20 mils is packed red blood cell in premature, and 25 mils is 25 mils per kilogram is in cases of whole blood in premature. Is it clear? So that's for blood transfusion. That's the first way that we can give blood transfusion. Blood transfusion can also be given as packed red blood cell blood. Is it clear? It's going to be 3 times the weight of the child. You measure the weight of the child times the HB deficit. Is it clear? The HB deficit is the HB level of the child till the HB that you want to arrive. If you want to arrive 10 grams per deciliter, and that is the target for the severe anemia in the cases of neonate. If you want to arrive, you have to subtract. Let's say that the child is at 5 grams per deciliter. You want to arrive 10 grams per deciliter. That is the target. That is the reference point between moderate to severe anemia. So you have to multiply times 5 grams per deciliter as HB deficit. While in the case of whole blood, you have to instead give 6 times weight of the child times the HB deficit. Is it clear? So that is how you have to calculate for blood transfusion. The other ones are for apnea bradycardia syndrome. If you want to prevent it, for apnea bradycardia syndrome, if you want to prevent it, you have to give caffeine citrate or aminophylline. If you want to prevent hypothermia, I've already explained. If you have to prevent electrolyte imbalance, you have to give calcium to the child. And calcium is given to the child at a dosage of 30 to 40 milligrams per kilogram total replenishment. It means that what? You replenish calcium for 2 to 3 days. Is it clear? You replenish calcium for 2 to 3 days. It means that this 30 to 40 milligrams per kilogram is not given per day, but it's given for the total duration that you want to replenish. If you want to replenish for 2 days, you give 30 to 40 milligrams per kilogram in 2 days. And if you want to replenish in 3 days, you give it in 3 days. It means that what? If you want to replenish calcium for 3 days at 30 milligrams per kilogram, it means that you're going to give 10 milligrams per kilogram every day for 3 days. Are you understanding? So that is it. And you need to know that 1 ampoule of calcium contains 90 milligrams One ampoule of calcium contains 90 milligrams of calcium. Is it clear? That is how you have to evaluate. The next one, you need to know that calcium can be replenished from day 1 because the child does not breastfeed, but sodium and potassium are replenished as from day 3. Why? Because if you have acute kidney injury as from day 1, which is also be shown by hyperkalemia and hypernatremia, and you give also sodium and potassium as from day 1, you are only going to increase the hyperkalemia and the hypernatremia, which is going to result to a death of the child, sudden cardiac arrest. Is it clear? So don't give it within the first 3 days, always giving as from the 3rd day. Is it clear? And sodium, you give it a dosage of 3 milli equivalent per kilogram per day, while potassium is given a dosage of 2 milli equivalent per kilogram per day, and the dosage of sodium is going to be 17 milli equivalent in 1 ampoule of sodium, while in potassium it is 13 milli equivalent in 1 ampoule of potassium. Is it clear? So that is how you have to replenish for the fluid. The next one is the follow-up for the breastfeeding. Is it clear? When you want to give breastfeeding every day, you have to control the residue. Is it clear? If the residue is less than 50% of what was given the day, the residue is less than 50% of all the breast milk given the day, it means that you are going to add by 20 milligram mils per kilogram of breastfeeding for the next day. If it is at 50%, you maintain the same fluid of yesterday, and then you add the 20 mils per kilogram instead in the serum fluid of the child. And if it is greater than 50%, you have to reduce. So let me explain. Let's say that you have a premature child. You say that the day 1 is going to start with 80 mils to 100 mils per kilogram per day. Are you understanding? Let's say that I want to start with 80 mils for the first day. It means that on the first day, I give the 80 mils per kilogram completely in glucose, 7.5%. Basically, I give completely in glucose the 80 mils. The next day, I'm going to normally add 20 mils per kilogram. It means that I will add the 20 mils per kilogram now in breast milk. It means that the child is going to have the next day 100 mils per kilogram, but 80 mils per kilogram is going to be taken via glucose, that's IV fluid, while 20 mils per kilogram is going to be taken via breast milk. Now, let's say that this child is going to have normal digestion, then the residue is less than 50% of this 20 mils per kilogram. It means that the next day I'm going to add that 20 mils per kilogram on the breast milk. Is it clear? But if instead it is at 50%, it means that I'm not going to add, but I'm still going to maintain the same 20 mils per kilogram, but I'm going to add the other 20 mil the next day. It means that here we are on the day 1. Here we are on day 1. Here we are already on day 2, where the child is supposed to take 80 mils per kilogram. Now on day 3, you need to know that by this level on day 3, the child is supposed to take 120 mils per kilogram. But I will not add the 20 mils per kilogram on breast milk. I will instead add it on the serum, because the child is not digesting well. The residue is going to be at 50%, so I don't want to add. It means that I'm going to give 100 mils per kilogram of the child through IV, and I'm still going to give 20 mils per kilogram through the feeding. Now, if I realize that the child now is instead having residue of more than 50%, if the child has residue of more than 50%, I will reduce again this by half. Is it clear? There is a certain formula you have to calculate even for the residues. You will reduce again by half, and you add the other 10 in this, and you add also the 20 for the next day. It means that on day 4, normally the child is supposed to be on 140 mils per kilogram. I can add the first 10 here, gives 110, and then I add the next 20, gives 130. So 130 is going to be given through IV fluids, 30 mils per kilogram given through IV fluids, and the other 10 mils is given now through breastfeeding. Is it clear? That's how you have to change according to the day. basically. So those are the different elements that you have to evaluate on the management of patients. In this case, other element of management, if the child is jaundice, you have to place the child on phototherapy. Basically, if the child, so there are other elements of the complication that you have to understand here. Afterward, we are now going to visualize now the follow-up.